Have you had to wait weeks to get an appointment with your own GP? Knowing by the time you actually get in to see them, you'll either be a lot sicker or you'll have battled through the worst of your illness without their help. Or have you struggled finding a new GP? If you're answering yes to those questions, you're not alone.
I've booked a doctor's appointment and I've got to wait 3.5 weeks before I can see anyone.
You might as well book an appointment every Monday and then ring them up and tell them you can't come if you don't need it.
I've been with my GP for 30 years. We were kind of old friends. But I couldn't get into her. She's pretty busy at the moment.
I went to the rapidly growing town of Sorell, which is about a half an hour drive from Hobart's CBD. Unlike other parts of Tasmania, it's currently facing a doctor's shortage. The Australian Medical Association says there are more than 60 vacant GP positions in Tasmania. It claims the pandemic, changes to the Medicare rebate and a lack of financial support from the Commonwealth are contributing factors.
Which is now adding up to a crisis, and it's adding up to unsustainable general practice.
In fact, the situation is so dire, there are currently no GP clinics in Sorell that are taking on new patients. When I rang, I was told the books are at capacity and it would be months until a locally based doctor could fit me in. I was told to try Cambridge, so let's see how a sick Sorell resident would go seeing a doctor out of town. It's manageable by car, but if you're relying on public transport, buses only come once an hour.
We could put another 4 doctors into Sorell easily. If we found another 4 doctors there, you would get in within a week.
It means some people have no choice but to go to the nearest hospital.
You don't want to trouble the Royal. That's where a lot of people end up, because you can't get into a doctor.
5 months ago, had to go to the Royal because you couldn't get in here at any time.
The AMA says it costs the state government up to $5,000 more if a patient gets admitted to hospital compared to an out-of-hours GP visit.
GPs can provide a lot of services to keep people out of hospitals, but they're not funded to do it.
I asked the Tasmanian Health Department whether more people were coming here because they couldn't see their own GP. It didn't answer that question, but said that they were trying to find more alternatives to hospitals.